Mitch LaPlante, who is on our faculty.
Well, good morning, everybody. Actually, the reprints of the slides for this panel are in the left side of your packet. If you haven't been able to find them, that's where they are. So in my presentation today, I'm going to talk about the need for help with the activities that most people take for granted but are essential for daily living, the activities of daily living and what are called the instrumental activities of daily living. This research is from the first project that Charlene just mentioned, based on analyses of large population surveys. And I'm also going to talk about unmet need when help is desired but it's not forthcoming, and the adverse consequences that can ensue from that sort of situation. Then finally, I'll talk about the potential expense of addressing unmet need for personal assistance and explain why this is less than it seems the Congress or the administration appears to think it is, at least for people with the greatest degree of disability who too often face institutionalization as their only option, which is potentially in conflict with the Supreme Court Olmstead decision and the direction that policy is evolving in. So, personal assistance services are those services that assist individuals in tasks essential for daily living, the so-called ADLs and IADLs. And I really think that personal assistance practice and policy begins with the rather unassailable idea that people have needs for help that must be met. Obviously, this is strongly so for the ADLs that are biologically driven, such as eating, and somewhat looser for the ADLs and IADLs that are more socially determined, such as keeping house or preparing meals. So a need for PAS exists if a person can't perform one of these activities, or as well may have difficulty performing an activity, or requires supervision or reminding or standby assistance. Need can obviously mean different things to different people, and I often have people saying, well, what do you mean by need? One of my teachers was a health economist, Victor Fuchs, and he said to me, a sociologist, you talk about need, I don't believe in need. I only believe in demand. So this kind of classification covers these different views. This is from a British sociologist, Bradshaw, who talked about normative need, which is need assessed by experts, versus felt need, which is what a person feels, and expressed need, which is, for Victor Fuchs, what a person demands by saying, I'll pay for this. And comparative need, which involves disparities in help received between different groups, older and younger, for example. So, first of all, we have to start out with how we measure need. And that's of critical importance for determining whether an individual should get help, how much help and what kind of help, but also for how, as a society, we deal with this by creating programs that address this problem and implementing them. And as probably all of you know here today, there's been considerable advancement in the measurement of need, beginning with Katz's development of the index of the activities of daily living, which makes up a Gutman scale with scores from 0 to 6, indicating greater level of disability the higher the score. A lot of research has been done on the validity of Katz's index of ADL, and there's an extensive literature that shows the number of ADLs measures the level of disability with good validity and predicts institutionalization and personal assistance use. So as a consequence, experts equate greater ADL disability with greater need, and the ADLs are used extensively in determining who gets help and in setting policy. Bill Spector isn't here today, but of course he's written about the fact that ADLs are not sufficient because they don't describe the full continuum of need that people have, and one has to include as well some of the instrumental activities of daily living, like meal preparation, managing finances, etc., to represent the full continuum. Now, we all know that the risk of needing personal assistance increases exponentially with age. This is a chart of the proportion of the population needing help with either IADLs or ADLs from the Survey of Income and Program Participation for 2003. And the black line is an exponential trend, so this increases even faster at the oldest ages. But these rates apply to a population that is pyramid shaped. And so the rates that are lower in the younger ages apply to many more people. The result is that almost half the population with a need for personal assistance is working age. And here, 46% are working age 18 to 64, 54% are 65 and above. And it's not just that, you know, the working age are 55 to 64-year-olds. It's actually fairly distributed by age here, with about 10% 18 to 34, another 10 35 to 44, another 10 45 to 54, and a little bit more 14% 55 to 64. And you know what that says is that if you're a paid caregiver, it would really be a 50-50 proposition whether a client you would be assigned to work with is elderly or not. So we've evolved different systems of personal assistance to deal with the different age groups. And most people think that these distinctions between disability and aging are artificial, as Mike Oxford talked about. But they continue to exist, and they are really the result of the different service delivery systems that have evolved. Some of this is changing, perhaps with the Aging and Disability Resource Centers and such, but not very quickly. So this means effectively that we do in fact make trade-offs concerning how much to fund what working age people with disabilities need versus funding what older persons need. And for reasons that I will shortly address, I think we have a responsibility to get that right in both cases.